What we're going to do today, as I said, is talk about the 4Ps plus and its use in identifying women at risk from alcohol and tobacco use. There are 5 factors I want you to think about as we start the screening process. These are factors that affect how the woman will respond to you and how well she's prepared to talk with you about her possible substance use. Negative heritage refers to the family history. Many women who use alcohol, tobacco, or illicit drugs during pregnancy grew up in a home where their parents, especially their mother, used alcohol, tobacco, or illicit drugs. And in studies of women who have used alcohol during pregnancy, we find that about 30% of those women themselves were exposed prenatally to alcohol. So you need to think about this as you work with the women. A second area is a history of trauma. Many of the women that are using alcohol and illicit drugs during pregnancy have a history that goes back to early childhood of a variety of forms of trauma, most especially including sexual violence. And so how do you think that affects a woman's ability to respond to you, to think about her own substance use? In fact, how does it prepare her to be a mother herself if she has a history of sexual violence? A third area is a lack of social support. Women, in the natural course of adult development, women are different from men in that women rely on social contacts, on relationships with other women. And if a woman is using alcohol or illicit drugs, it is more likely than not that she is socially isolated and doesn't have the opportunity to relate to other women. So you have to think about this as you try to develop a relationship with her, in that many times a woman who's abusing alcohol or is using illicit drugs has not had the opportunity to relate to other women. A fourth area is cognitive functioning. And it's not just the impact that chronic alcohol or illicit drug use can have on global cognitive functioning, but it also affects the ability to plan ahead, to think through, to understand consequences of behavior. And so what that tells us as we work with women and are trying to especially provide brief interventions, we have to consider that we have to be very concrete in our language and make things very clear. And finally, psychological functioning. We know that another way in which women with a history of alcohol abuse or illicit drug use differ from men is that women have much higher rates of co-occurring mental health disorders. And so, especially depression and borderline personality. And so as you work with the woman, these factors are going to affect how she relates to you, how she responds to your questions, and you're going to have to be very aware of this as you work with the woman.
Taking these factors into consideration, we're going to look at an overall SART system. SART stands for Screening, Assessment, Referral, and Treatment. Now, the purpose of screening is to identify women who are at risk for substance use. The purpose of assessment is to question further the women who have a positive screen, and assessment will tell you who is actually using. The third step is brief intervention and referral. As part of the referral process, we provide a brief intervention that will help the woman come to consensus that she will stop her alcohol or illicit drug use. And finally, for those women who need treatment, an appropriate linkage to treatment programs in the community. So that is the SART system: screening, assessment, referral, and treatment. The 4Ps Plus was developed to fit within a comprehensive SART system. The screen takes less than 1 minute to perform and has very good validity and reliability in identifying women at risk. There are 4 basic questions. The first question has to do with parents. Did either of your parents ever have a problem with alcohol or drugs? Now, one of the difficulties that practitioners get into is how to initiate a discussion about alcohol or drugs. The best advice I can give you is put it into the context of the family history. So you could ask questions such as, did either of your parents ever have a problem with high blood pressure? Did either of your parents ever have a problem with diabetes? Did either of your parents ever have a problem with alcohol or drugs? Now you can see how that flows, and that's called normalizing the question, because what you've done is taken a medical interview and incorporated drugs and alcohol into the kinds of questions that clinicians always ask. Now, if a woman says her parents had a problem with alcohol or drugs, that doesn't really give you much information about her risk for use. But it is a good way to introduce the issue. The second question, the second P, is for partner. Does your partner have a problem with alcohol or drugs? Now, you don't have to say partner. You can say spouse, husband, significant other. But what you're getting at here is the woman living in the context of a family life complicated by alcohol or drug use? Now, again, a positive screen, if the woman's partner is having a problem with drugs or alcohol, this doesn't necessarily mean that she has a problem with alcohol or drugs, but what it does tell you is if the woman is at risk for domestic violence. There's about a 65% correlation. If a woman answers yes, her partner has a problem with alcohol or drugs, there's a 65% chance that there are issues of domestic violence. The third P is for past. Have you ever had any alcohol? Now, as you'll see in a moment, the actual 4Ps plus form does not say alcohol. It says, have you ever had any beer, wine, or liquor? Because we know that most people in the United States do not consider wine or beer to be a form of alcohol. So you have to be very specific. And if you're working with an adolescent girl, then you have to say, have you ever had any beer, wine, liquor, or hard lemonade, or wine coolers? So you have to know what is popular among your population. Again, this doesn't give you much information about current use, but what it does tell you is it gives you a bigger picture of the woman's past. Now, the two most important questions, the two questions that actually tell you if this woman is at risk for alcohol abuse or illicit drug use, are the two questions under pregnancy. And listen very carefully to the way these questions are asked. In the month before you knew you were pregnant, how many cigarettes did you smoke? In the month before you knew you were pregnant, how many beers, how much wine, how much liquor did you drink? Now, those two questions have to be asked exactly as they're written here, which is why we also are supplying you with the 4Ps plus form in Spanish, because we don't want you translating off the cuff, but we want you to ask the questions exactly as they're written. Now, let's examine those two questions. If you change that first question to the following, in the month before you knew you were pregnant, did you smoke cigarettes? The question loses validity. You have to ask, how many cigarettes did you smoke? That's called an open-ended question. Also, if you say, in the month before you were pregnant, it loses validity. You have to say, in the month before you knew you were pregnant. Again, that's an open-ended question that gives the woman an opportunity to think about before her pregnancy, and it's much more likely that she will answer honestly. The same goes with the second question regarding the various forms of alcohol. These 5 questions are known as the 4 Ps plus, and it gives you an indication of this woman's risk. If a woman answers that she had any alcohol or any tobacco use in the month before she knew she was pregnant, that is a positive screen. Now you'll notice this says Luna County, New Mexico. That's because we're going to be moving across the state eventually to multiple counties. Now at the top, you'll see the demographic information that is being collected on the women. And everyone is going to screen at the first prenatal visit. And so you would check off first screen. Some sites are repeating the screen later in pregnancy, and so you check off if it's a repeat screen. You also fill in how many pregnancies or how many births the woman has had prior to this pregnancy. And in the far right, you see the date of birth that you fill in, and then whether the woman is pregnant, if this is a prenatal visit, or if it's a postpartum visit. Now, since this is going to be primarily in WIC, most of the women will be pregnant and part of the prenatal period. And then the rest of the information is fairly self-explanatory as far as the demographic data. Then listed here in the squares, you see the questions we just talked about. But let me call your attention to some specific areas. First of all, the parents question is as we said. Now under partner, we've expanded the questions to include further screening for domestic violence. So in addition to, does your partner have any problem with drugs or alcohol, there are 3 additional questions. Is your partner's temper ever a problem for you? Have you ever felt out of control or helpless? And does your partner threaten to hurt or punish you? These are all questions, any one of which a yes answer tells you that this woman is at risk for domestic violence. Under past, after have you ever had any beer, wine, or liquor? We asked 2 questions that have been shown to be reliable questions to screen for depression. In the past 2 weeks, have you ever felt down, depressed, or hopeless? In the past 2 weeks, have you lost interest in things that used to be fun for you? Again, a positive answer, a yes answer to any one of these 2 questions regarding feeling down, depressed, or hopeless, or losing interest in things that used to be fun, a positive answer to either of those requires further assessment for depression. And then there are some minor changes to the pregnancy questions. You'll see the first 2 are similar. In the month before you knew you were pregnant, how much beer, wine, or liquor did you drink? In the month before you knew you were pregnant, how many cigarettes did you smoke? But from what we've learned in New Mexico, with marijuana use being as prevalent as it is, we've added a 3rd question under pregnancy. In the month before you knew you were pregnant, how much marijuana did you smoke? And because of the increasing use of prescription medications, often without a prescription, we ask a 4th question under pregnancy. In the month before you knew you were pregnant, what kinds of prescription pain medications or anxiety medications did you take? You can see in the far right-hand column if the woman had any alcohol, any tobacco, any marijuana, or any prescription pain med use. You check off any under the proper category, and that tells you that woman has a positive screen. If the woman has any responses that are positive, then you must go to the bottom part of the instrument, which says follow-up questions. So all women with any answer that is positive under pregnancy must be asked the questions, the 6 questions, in the second half of the form. And if you look at those, we're not going to go through each one of them, but if you look at those carefully, what you see, it starts asking questions about last month. So what that tells you is, since she's known she was pregnant, because most of the women will have known they were pregnant for more than a month, this tells you that the woman, since she's known she was pregnant, was using. Now, I know that it jumps around a bit, but this is to keep the woman from getting into some kind of pattern in which she just answers the same thing for every question. And so we've scattered the responses between in the month before you knew you were pregnant and last month. If a woman answers anything that is highlighted in white, such as every day, 3 to 6 days a week, 1 or 2 days a week, or less than 1 day a week, that woman is using a substance during the pregnancy. And the next step is you have to go to an on-site brief intervention. And all of you have received the I am concerned brief intervention. So what you're going to do in the bottom part of the form now is you're going to offer the woman a brief intervention and check if she refused or accepted it. So all women with a positive follow-up question is going to receive a brief intervention. Depending on what else you find during the interview, you may be offering tobacco cessation, mental health interventions, domestic violence intervention, or referral to a substance abuse treatment program. And again, you check off if she refused or accepted. So this is the 4 Ps plus form. The top half takes about a minute, the bottom half takes about 2 minutes to complete. It's very straightforward. It's been used in multiple programs around the country, including in Luna County already through the Board of Health Clinics and some private practitioners. And we've had some great success with it. So that brings us to the brief intervention. And if you have a brief intervention manual there entitled I Am Concerned, you can pull that manual out now and look at it as we talk through this portion of the presentation. The first step is what we call a linking comment or a bridging comment. What you want to do, if after you have asked all these questions, you should say, thank you for letting me know. That's positive reinforcement. That tells the woman that you're not judging her, that anything she tells you is appreciated, and it helps develop that relationship with the woman. So you say, thank you for letting me know, and then you say, I am concerned. Now, why do we say I am concerned? We found in our research that the most common response that people gave if they found out a woman was using drugs during pregnancy were very harsh statements such as, oh my gosh, do you know what you're doing to your baby? Or something like, if you don't stop using, CPS is going to take your baby away from you. Comments like that, all they do is drive the woman out of WIC services, drive the woman out of prenatal care. And so you make an I statement. I am concerned. Because as a health professional, the woman will listen to you. I am concerned, and let's pretend for now, let's say the woman has a positive screen and assessment for alcohol use. I am concerned because I know when a woman uses alcohol during pregnancy, the baby can be born too small and too early. And I know the best thing you can do is stop drinking. Now you'll notice there, this is a very important point. You'll notice there that this is a zero tolerance approach. We know that no amount of alcohol, no amount of drugs, no amount of tobacco is safe to use during pregnancy. And so we're not going to say we want you to cut back. We're saying we know that the best thing you can do is stop using. Now, what do most women respond with that? They'll say, well, I use with my other pregnancies and my children are fine. Or my mother smoked when she was pregnant with me and I'm fine. The woman will come up with all sorts of statements. Your response, you can't argue with her. Your response is, I understand, but I am concerned. Now, at this point is we go into what is couched in motivational interviewing. And the first 3 steps are just as I told you a minute ago. First step is the bridging comment. Thank you for letting me know. Providing feedback. I am concerned because I know, and then I know the best thing you can do is stop using. So it's the bridging comment, the feedback, and then advice. The woman most likely is going to get a bit upset, and so you need to acknowledge that. You empathize with the woman. I see you're upset. Or, I know this is hard to talk about, but I am concerned because I know the best thing you can do is stop drinking. And at this point, you want to move to motivating the woman. Now, some key issues with motivating women to stop their use can be described as the OARS process, OARS. O is for open-ended questions. And just like in the screening process, we didn't say, did you use cigarettes? We said, how many cigarettes did you use? That's an open-ended question. And here, you start with an open-ended question. So tell me more about your use of alcohol. And let her talk about that. As she talks about it, try to affirm whatever you hear that's positive that comes from her. Many of the women will say, well, sometimes I kind of worry. My husband wants me to have a martini every night when he gets home. And I've kind of worried about that, but I've been, having it with him. I didn't want to upset him. So you want to find something positive in that statement. Well, that's good that you've been thinking about this. You want to reflect back. You want to make sure the woman realizes that you're listening to her. And so you can say something like, now, tell me if I'm wrong, but it sounds like what you're telling me is you're having 2 glasses of wine 3 nights a week, and you're concerned about that. And then let the woman talk, and then summarize for her. Now tell me if I'm understanding you correctly. So this is a process it accomplishes 2 things. It lets the woman know you're hearing her, and then it also lets her hear back the fact that she is drinking 3 glasses of wine 2 nights a week. And in hearing that, she'll begin to realize that that's probably too much. Again, empathize with the woman at any point when it's necessary. I see you're upset. I know this is hard to talk about. Motivate her through the OARS process, and then negotiate a plan. Now, in negotiating a plan, it's important to have the woman actually lead the process. Now, in reality, you're leading the process. You're just not letting her know that. So you can ask a question, well, on a scale of 1 to 10, how ready are you to talk to your husband that you can't have those 3 glasses of wine every once in a while? How ready are you to stop using completely? And she'll give you an answer such as 4. On a scale of 1 to 10, with 10 being absolutely ready to stop, she says 4. Then you can explore further with her, well, why did you give yourself a 4 instead of a 2 or a 3? That gives her an opportunity to talk about the positive things she knows about alcohol use, and that leads you right into talking about her personal choices. So what are the choices you have? How do you think you can best approach this? Whenever she starts talking about how difficult it is, or her husband will get angry with her if she doesn't have a couple of glasses of wine with her, you want to just roll with the resistance. You can't argue with her, but say constantly, I understand, but I am concerned. Remember, continue to express empathy. I know this is hard to talk about. And keep coming back to the pros and cons. And any of the pros that she's talked about, her knowledge that she really should quit, you need to repeat back to her. And then to help her find that pathway to stopping use, you promote self-efficacy. And you can ask her questions like, well, what do you think would help you to stop? You don't want to argue. You don't want to get into power struggles. You certainly don't want to lecture, and you don't want to make assumptions. And remember, this is all a conversation. We've talked before about screening is really a process of engagement, engaging the woman in a conversation. Now, I know that the WIC program has been using some screening instruments in the past, but what we know from scientific research is those questions are not validated questions. So that's why we're moving toward using the 4Ps Plus, which is a validated instrument. It is very efficient. It takes, as I said, only 1 minute to do the screen and about 2 to 3 minutes to do the brief intervention, including the motivational interviewing. And so what you want to do is begin incorporating this into your practice. Now, many people ask, does this really work? Is this something I can really do in my busy practice? And so what I thought I'd do is we made a film of one of our groups. This group happens to be in Hawaii. But we interviewed some of the practitioners who had been administering the 4Ps Plus and the brief intervention, as well as some of the patients, some of the pregnant women who had received the intervention. And so I thought I would play that short video for you so you can see what others think about this process.
Family is number one, ohana, taking care of the children. The children are the one that we have to take care of.
It's just important to have family. And the children is important too.
Many times, old school, myself included 19 years ago, was told that it is okay to have a drink or two during the week on a weekly basis when I was pregnant. So has that really changed today? And do these women really know the implications of what can happen?
Really, it's surprising how many people do actually drink when they're pregnant, or smoke when they're pregnant, or don't think anything of drug use when they're pregnant.
In our community, yes, women are drinking while they're pregnant, or smoking tobacco, or using other types of substances.
What the 4Ps Plus allows us to do here as people and clinicians screening women who are positive for pregnancy allows us to discuss with them in a gentle and non-threatening way better choices around a healthy pregnancy.
Our program's been using the 4Ps Plus for I think about 2 years now, and we've really seen a positive response, one to just answering the questions. The women are really open and interested, and then using the brief intervention tool to making changes and learning from that. And we get a lot of questions and just a lot of interest in the subject. And the real discussion has started with the 4Ps Plus screening tool.
It gives me a script that I ask everybody. So it's not like I'm just asking this one individual because I suspect that she's drinking. I just say, well, this is just what we ask everybody.
It has good guides, which is great, so that whether it's yes or no, there's interventions and steps to take as far as what to educate them on next.
Using the 4 Ps helps you to open the door in communication when you're trying to develop a trusting relationship with a new patient. It lends a safe period, a safe place where we can talk about any kind of alcohol exposure or substance abuse, and it's a first open door, and we look at that every time we see the patient.
When I was asked about drugs and alcohol, I can definitely say that I was comfortable and confident in talking about it. Having the Malama Perinatal Program to give me the information on what I shouldn't and should be doing, you know, has made me a good mom. I'd like to hope I'm a good mom, and I think I am, you know, but they pointed me in the right direction, and I think that having the Malama Perinatal Program can only help to prevent substance abuse in Hawaii, definitely.
Okay, well, thank you very much. This was just a brief overview of the training that we did do when I was out in New Mexico about a year ago to train for WIC. And I hope that it has been helpful to you.